Hi guys! So today I'm going to be doing a video on what to expect on your first day of nursing clinicals. So nursing clinicals are such an exciting thing to think about if you haven't been in nursing clinicals already, but it also can be a little stressful and overwhelming, especially if you've never been in a hospital setting or patient care setting, if you've never been into patient rooms, if you've never really communicated with patients, and it can be really overwhelming and a little stressful to kind of think about your first day of clinical. So I'm going to be making a little video on what to expect on your first clinical day, and then kind of my experience on my first clinical day. So my first clinicals were at a long-term care center, and we started the clinicals about halfway through the semester after we sort of got our basic assessment skills down, our basic care skills like bedpans and baths and changing beds. Once we learned those kind of skills is when we started our clinicals. So I was really excited for my first day of clinicals. I thought, it's going to be so exciting to finally apply what I've been learning to patients and actually get to experience what it's like to be a nurse. On my first day, I definitely felt very overwhelmed. I also had been sick leading up the whole week to that first day of clinicals, and I had only been sleeping a few hours a night, and then the night before clinicals I actually was so anxious and excited for clinicals, but then I couldn't sleep because I was sick and I was excited, and so I only probably slept like 2 or 3 hours the night before clinicals. That actually came back to bite me, and I'll explain that a little later on. So my first day of clinicals, my instructor was there with us, and she kind of threw us to the wolves, my clinical group and I. She kind of threw us to the wolves a little bit because it's our first day. We had no idea what to expect. We had no idea what we're doing. It's like you learn all these things, but the second you have to actually apply it, all of a sudden you're like, oh my gosh, I don't remember anything. And she kind of just threw us to the wolves. We got there, she kind of toured us around the facility, then she's like, all right, everyone go pair up with a CNA, and you're going to help them for the next couple hours with whatever they're doing. And so my first day I was bathing patients and doing bedpans and changing briefs and all these things that are more of the dirty side of nursing. And I was just really overwhelmed, and I was really tired, and being sick that whole week and then not sleeping well the whole week, I actually felt really sick that whole day at clinical, especially when you're changing briefs and you're smelling all these smells that you're not used to. I did not feel very good at all. At one point, I actually almost fainted, and I have a very strong stomach. I can see blood, I can see wounds, I can see, nasty feces and all of the gross stuff that nurses have to deal with. But I had a patient who had a really big pressure ulcer, and I had never seen a stage 4 pressure ulcer, and it was no kidding, this big. And I was standing in the room, one of my friends was in the room with me, and all of a sudden, when they took the bandaging off the pressure ulcer, I just felt so lightheaded. And I think part of it was I, hadn't been feeling very good, and then to see something I'd never seen before, all of a sudden I was so lightheaded, and my vision started going in and in, and I had to leave the room, and I went to the bathroom to sit down, and I felt like I was going to get sick, and I felt like I was going to pass out, and I was like, I don't know if I can be a nurse anymore if I can't get through this. And it was so weird to me because I love seeing gross things, if that makes any sense. I know it's kind of weird, but I love seeing gross things, and so the fact that I felt lightheaded and kind of sick when I saw it, I was like, oh, maybe I shouldn't be a nurse if I can't see this. But I was totally fine. After that day, I went home. I obviously recovered, and then my next clinical day was the next week, and I did a lot better, and I had a good experience, and I learned a lot. So my first day was kind of a little mess, I guess you could say, but it was a great learning experience. And I want you guys to know that if you're going into your first clinical day, it's okay to be nervous. It's okay to feel overwhelmed. It's okay to feel like, oh my gosh, I don't really know very much, because you're just learning, and you're not to say you're just a student, because you are a nursing student. And trust in what you do know, and bring those skills with you on your first clinical day. It's also okay to know what you don't know. It's actually very important to know what you don't know. If a CNA or a nurse is wanting you to do something that you don't feel comfortable with doing, it's okay to say, hey, can I watch you, or can I assist you, because I'm not completely comfortable with doing this yet. Because the last thing you want to do is compromise the care for your patients or God forbid, hurt them in some way. And I just think it's important as student nurses that we recognize when we're not comfortable with doing something, and we practice on getting more comfortable with practicing our skills and working with patients. It's also okay if you feel very nervous to walk into your first patient's room. I remember I actually volunteered at a hospital before I went into nursing school, but my first day on the volunteer job, I was terrified to go into a patient's room. I was like, oh my gosh, I don't know what to say. Are they going to be nice to me? Are they going to realize I'm so nervous? And as I practiced and as I went into more patients' rooms, I got a lot more comfortable and a lot more confident with that. So I think that's a very common thing for you to feel nervous when you go into your first patient's room, and just have a very open mind to it. Think about how you would feel if you were a patient in a hospital and you had nurses coming into your rooms. Chances are the patient is probably more scared of you than you are of them. I also had an instructor tell me something that has stuck with me through my nursing journey so far, and what this instructor told me was, think about how you feel right now going into a patient's room. Think about how nervous and how scared you are and how you feel so vulnerable. And remember that feeling, because as you become more comfortable and confident as a nurse, you're going to kind of forget that feeling of what it's like to be so scared and vulnerable. And that is how your patients are feeling in the hospital. They're feeling scared, they're feeling vulnerable. So being a student nurse, you're almost closer to your patients and how they are feeling right now than you will be when you've become an experienced nurse. So remember that feeling that you have of being scared, and know that's how your patients are feeling, and so you can kind of comfort them more, knowing that you know how it feels to feel that way. Alright guys, well I hope you enjoyed my video on my first clinical day / what to expect on your first clinical day. The best advice I can give is to go in open-minded. Be open-minded to what you're going to experience, try new things, but also be safe when you're practicing your nursing skills. Know what you don't know, and the only way that you're going to get more comfortable and confident is to practice and to get that hands-on experience. So be really open-minded. I know that maybe changing bedpans and briefs isn't the most beautiful part of nursing, but it definitely is important, and it's a good nursing skill to have. Alright guys, thanks for watching my video. Make sure you give it a thumbs up and subscribe to my channel, and I'll see you next time. Bye. Look at you. You can be on the camera. And I just think it's... So my first clinicals were